Hello, I'm Dr. Justin High at Reata Equine Hospital here in Weatherford. This is Jessica and this is Star, and we're going to talk to you today a little bit about how to do some very basic examinations on your horses to make sure you get some good information. That way you can make decisions about whether you need to call a veterinarian or whether you do have a problem. And the most simple thing we're going to start with today is just doing a simple temperature, pulse, and respiration exam on your horse. Now, to start with, we're going to do her temperature first, and on a normal horse, even on a hot day like today, it should be between 99.5 and 101.5. Even on extreme temperatures, horses aren't going to vary much more than a degree from what their normal body temperature is. So the safest thing to do is get you a digital thermometer. Glass ones work as well, but I think they're a little bit more dangerous. And then also make sure you have a cooperative patient. Star's really good here, so what we're going to do is turn our digital thermometer on. And I always stand away from the horse. Raise the tail up a little bit. Place our thermometer in. And most of the time, if you just scratch on them, make sure that they know you're here, everything's alright. Most digital thermometers only take just a minute or two to read. That one beeped, and her temperature is 100.0, which is exactly what it should be. And for her, that's her normal temperature. One of the other things that you can do while you're back here and your mare's quiet is you can assess what their respiratory rate is. And the easy way to do that is, even while you're taking your temperatures, just watch their flank and you can see how much their chest goes in and out. Oftentimes it's difficult to hear lung sounds on a quiet horse, but you can get your respiratory rate easily just by doing this. And a resting respiratory rate in a horse should be somewhere between 16 to 18 breaths a minute. Anything increased over that, you need to make sure your horse is not stressed or excited, and that's why that's increased, or that they actually have a problem that's creating a harder time for them to breathe. So if you do have a stethoscope, you can use that, and the best way to count their respiratory rate is to actually listen to their trachea. Right in the center of their throat, just place your stethoscope right in the front, and we can easily count what her respiratory rate is and actually get a decent idea of what her lung sounds are. To listen to lung sounds in a horse, they're outlined typically by their ribs. So we want to start up high, listen, and you really shouldn't hear anything on a quiet horse. And then progress down between the rib spaces all the way to where you get to right where their heart is. And this is by far the most definitive way to get your heart rate. Make sure their elbows out of the way. Place your stethoscope right over their heart, and you can easily hear what their resting heart rate is. Star's resting heart rate is about 28 to 30. And most horses are going to be between 28 and 36 that are quiet and not excited. The other way you can assess your horse's heart rate is by evaluating their pulse. And besides listening to their heart rate, the easiest way to do that is right underneath your halter on the curve of their jaw. There's a big artery called the facial artery, and if you just put a light little bit of pressure on that, it doesn't bother her, you can easily feel a pulse and count that. And again, that should be somewhere between 30 to 36 beats per minute. The other thing that you can do is, if you have somebody holding your horses, you can listen to their heart rate and feel for a peripheral pulse and make sure that you don't have any pulse deficits or that there's any cardiac problems or something that you need to investigate a little bit more. Another way you can help evaluate your horse's respiratory rate is just by, you can put your hand over their nostril, make sure they have an even amount of air coming out of either one of them, and then count the respiratory rate there. So having a general amount of knowledge about what your horse is, temperature, pulse, and respiration, gives you an idea of what normal is, and that way, if you have a problem, you can make a better decision as to whether or not you need to have your horse looked at, or if there is problems that you're dealing with now. If you have any questions, be sure you give us a call, and hope you have a good time doing it. Thanks.